Hey, Adam Cooper here with Senior Healthcare Insurance, and in this video we're going to talk about Medicare supplement rates. But before we do, go ahead and if you haven't subscribed already, go ahead and hit that subscribe button. That way you are notified whenever I upload a video. And if you find value in this video, go ahead and hit the like button as well. I appreciate it. So when it comes to Medicare supplements, there's a few misunderstandings about when you can actually make changes to your Medicare supplement. So, and just before we get into all that, just a real quick explanation, if you will, of the difference between a Medicare supplement and Medicare Advantage. So Medicare supplements are secondary insurances to Original Medicare, the red, white, and blue Medicare card with the A and the B on it. Medicare Advantage plans are indicated with, you have either an HMO or a PPO, quite possibly a PFFS. Not as popular nowadays, but most of them are going to be either an HMO or a PPO, and they include prescription drug coverage a lot of the time. Now, there's some of them that don't, but just in case you're just not really sure what the difference is, the Medicare Advantage plans are also known as Medicare Part C, and most of the time they include a prescription drug plan. Now, these are the advertisements you're constantly seeing on TV and getting phone calls about and stuff in the mail about. Medicare supplements, however, they're indicated with a letter. So usually you're going to find either a Plan F, a Plan G, Plan N, some of the older ones Plan J possibly, but nonetheless they're secondary insurances to Medicare. And from time to time they do have increases in their premiums. So we're going to talk about that. What can you do about it? Well, a lot of people think that you have to wait until the Medicare annual enrollment period, which falls between October 15th and December 7th. That time of the year is specifically designed for Medicare Advantage or prescription drug plans. So that's the time of the year to reevaluate either your Medicare Advantage plan or your standalone prescription drug plan, make any changes or adjustments you need to, and that will take effect on January 1st of the following year. Now, when it comes to Medicare supplement plans, however, if your rate increases, you can shop around and find another plan that gives you the exact same benefits because they're standardized. Other than a few states around the United States, they're all standardized, which means if you have a Plan F and you're looking for another Plan F at a lower rate, you're going to get the same benefits. Different insurance company, lower rate. Same thing with Plan G or Plan N, whatever it may be. If you're looking at the same plan, you're going to get the exact same benefits with another company, just at a lower rate. And I kind of equate this kind of like to a car dealership. So there's a lot of different car dealerships that sell, say, Chevy. Well, if you have a car dealership over here that sells Chevy and this one over here sells Chevy, but they're two different companies, and you're in the market for a brand new vehicle and you're looking at the exact same model on both lots, everything's identical, same color, you're going to get the same service, you're going to get the same warranty, things like that. It's everything being identical, but one company, one dealership is selling that plan for $5,000 or that vehicle for $5,000 more than the other one. Which one are you going to choose if everything's being equal? Same thing with Medicare supplement plans. They're standardized, so it's really easy to help shop on price. Now, some of those plans, some of the companies, they have health questions that are different than others. But here's the deal. What gets kind of confusing is when you're first becoming eligible for Medicare, either by turning 65 or your Medicare Part B starting, you have a time period that you don't have to answer any health questions, meaning you sign on the dotted line, you get whatever plan that you chose. Now, later on down the road, 2, 3, 4 years down the road, if you have that same plan and you decide you want to change, well, now you have to go through the medical underwriting requirements. But the good thing is you can do it at any time of the year. So if you get a rate increase and the insurance companies are supposed to give you at least a 30-day notification before that rate increase happens, you can look at it and say, hey, let's find out if there's anything else out there that gives me the exact same benefits just at a lower cost. Well, you can do that any time of the year. You don't have to wait until the Medicare annual enrollment period. So in order to qualify, you have to go through the medical questions and find out if you're healthy enough for that insurance company to accept you to be a new customer of theirs. So when it comes to those health questions, some companies are more lenient on certain conditions than others. So you have to kind of look at those different things and aspects and figure out which plan makes the most sense, but of course saves you money in the long run. And at the end of the day, that's what you're looking for, is to have a lower premium. And that's what I do. Is as an independent broker, what I can do is go out and research the market, find out, okay, here's some plans, some companies, same plan, that offer lower premiums than what you're paying right now. Let's see if you qualify. Now, there may be some health conditions that you don't qualify for, so therefore the good news is the Medicare supplement plans are what's called guaranteed renewable, which means as long as you're paying your monthly premium, they cannot cancel your plan based on how unhealthy you become or how much you utilize the insurance or anything like that. You're guaranteed to keep it as long as you pay your monthly premium. You keep up your end of the bargain, they'll keep up their end of the bargain, which is keeping you insured as long as you're paying your premium. But what happens is when those premiums increase, a lot of people just sit on it and don't do anything. Well, shop around. And again, that's what I do, is I help shop around. As an independent broker, I'm not working for one specific insurance company. I'm looking out for you and finding you the best deal. And if I can help you determine that and figure out, hey, this plan over here is going to save you enough money that's worthwhile, and I help you do that, my services to you don't cost anything. But the insurance companies, when I bring them a new customer, they pay me a commission, and that's how I earn a living. So my services, again, to you are free. Now, what a lot of people also think is, you know what, I've got high blood pressure, or I had a heart attack 4 years ago, or something like that. Well, guess what? Go ahead and look anyway. Now, there may be the fact that, yes, your health isn't up to par to be able to switch plans and save money, but you're never going to know unless you find out. And that's what I want to encourage you to do that. If you have a Medicare supplement plan and you've had rate increases over the years, go ahead and let's look around and let's see what we can find for you. And if there is anything, I'll let you know. If there's not, then I can't. And at least you know where you sit. Now, my number here is 870-215-3136. You can either call that number, you can also text that number and ask me any questions you want. Now, what I do is go through the health questions. I don't fill any paperwork out until I can determine whether or not that insurance company, if it makes sense for you to apply for that plan from that insurance company. So I unofficially, right, I don't fill any paperwork out. I just go through the health questions and I determine, okay, what my job is to determine whether or not it makes sense to at least submit the application to the insurance company. The insurance company, they're the ones that actually make the final determination. They go through there, they pull some reports and help determine on whether or not they're willing to accept you as a new customer. And then once they say yes to you, that's when we cancel your old plan. And now you have a new company, same plan, same benefits, at a lower rate, saving you money. So for instance, just last month, now this is kind of an extreme example, but just last month, I helped a lady. She had a plan F. I found her a different plan F and saved her over $100 a month, over $1,200 a year. Now, can I always save everybody that much? No. Sometimes it may be $30, $40, $50. It just kind of depends. So again, if that's something that you're wanting to look at and see if we can lower your rate and save some money, put some money back in your pocket, let me know, and I can help look into that for you. I hope that helps out. And remember, the big thing is you don't have to wait until October to make a change on your Medicare supplement to find a lower rate. You can do that at any time of the year. So again, my name's Adam Cooper with Senior Healthcare Insurance. If I can help you out, feel free to give me a call. Again, my number is 870-215-3136. And I look forward to speaking with you on the phone or seeing you in another video. Bye for now.